Good afternoon, everybody. And yes, I too do want to offer my condolences to the families and friends of the individuals who have passed, and echo the Premier's comments. These are not just numbers. I fully recognize that there are individuals and families, and that is the forefront of all the work that I do, and I know all my colleagues in public health, that at the end of the day, this is about our job is to help Nova Scotians to be as safe and healthy as possible. We do have now a total of 55 Nova Scotians who have died due to COVID-19. I'm also reporting we have 8 new cases of COVID-19, bringing the total number of cases in Nova Scotia to 1,034. 6 of the new cases are from Northwood. The 2 others are also in Central Zone, and one of those is a known contact of a previous case. So we still continue to see very low levels of cases that would indicate community exposure, which is extremely encouraging to me, and I hope to you. The QE2 lab processed 473 tests yesterday. We currently have 9 individuals in hospital, 5 of those in the intensive care. We have 918 people that have recovered from their COVID infection, and we have 35,375 people who have been tested and have negative results. There are 3 licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. Northwood in their Halifax campus has 25 cases and 15 staff that are considered active. There is 1 other facility with a single staff member and a 3rd facility with a single resident who are considered active cases. While things are encouraging, it's very important that we continue to be very vigilant and look and detect any cases of COVID-19 that are around. It's important, and I'll say once again, anybody who is feeling unwell and has 2 or more of fever, new or worsening cough, sore throat, runny nose, or headache, there is a possibility that these could be related to COVID-19, and it's important that if you meet those criteria, that as quickly as you can, you contact 811, either online if possible, or if that's not possible, calling them to seek a further assessment, and they'll direct you for testing as necessary. As we continue in our consultations and work on the reopening plan, and as the Premier has just said, I want to talk a little bit more about loosening more restrictions, allowing Nova Scotians to have more social connections. And I think the social connections is really important. We are, after all social creatures. There's growing science around the health impacts of isolation. And I think that maybe there's a good argument to be made that Nova Scotians are more social creatures than many other people in other parts of the country and the world. Connecting with family and friends is critically important for our collective mental health and for sustaining a positive sense of community. For almost 2 months, we've asked you to stay at home, away from family and friends unless it was essential. I know how hard that has been for everybody, but despite that, people have listened, and I thank you for that. For the last week, we have seen low case numbers. Our collective actions are flattening the curve. That's why in discussions with the Premier, we feel it's the right time to talk about more opportunities for social connection, but doing that carefully and safely. The Premier has described the immediate family bubble. This could mean parents, siblings, grandparents, whomever you consider your immediate family choice to be. It's up to you to define that. One household can have a close connection with one other household who is part of what they determine their immediate family. It's important that people understand that this does not mean that families can get together in large groups for barbecues and reunions. What we're announcing and is a very first step in allowing immediate families to gather in small groups. We're asking you and we're needing you to take it slow and make informed and wise choices. Before you have a close contact with family, we need you to consider 3 main things: age, occupation, and health condition. Think through these important questions. Is anyone at higher risk of severe disease from COVID-19 infection? If people are 65 or older, especially if they have underlying health conditions, or if there are people, regardless of age, with significant chronic disease or are immune compromised, those people need to be much more careful about who they connect to. We also have to think about, does anybody have frequent contact with the general public or part of their job, or for some other reason, maybe at higher risk of being exposed to COVID-19? Again, though, you need to be especially careful about who those people connect with. And it's critically important that even though you may make a choice and start to connect as a family, if anyone in either of those family bubbles are sick or showing symptoms, then there should not be visiting between those households until that individual is either better or has been, if necessary, has gone and got tested and been cleared of having COVID-19. I'll give a couple of examples. If your grandfather has chronic obstructive lung disease, COPD, consider not having close contact with him, as hard as that may be. He's more vulnerable to severe illness. If your sister is a healthcare worker, especially if somebody who's in frontline healthcare worker in possible contact with COVID-19 patients, you may want to consider social distancing in case she has had contact with the virus and may spread it. We don't want to put anyone at increased risk or create conditions where the virus can easily come back and spread. If that happens, we can find ourselves back at square one. I know this is not a one-size-fits-all approach. Some of you may not have immediate family who live in Nova Scotia. Some people, unfortunately, are estranged from their immediate family. But I want people to recognize that even though this doesn't fit for everybody necessarily, this is a first step towards opening up our social networks in a measured way. I also want to talk about opening up outdoor activities to allow all of us to get out and be more active as the weather gets nicer. We have black flies at our friends that we want to go and meet again this year. As of today, beaches are open for walks. Paddling, surfing, and other activities can also resume. We want to get people outdoors to be active and do it at a safe distance of 6 feet. We have worked with Sport Nova Scotia to identify activities that can be done individually or in small groups. Archery, equestrian events, golf, paddling, sailing, and tennis. Each of the provincial organizations responsible for these outdoor activities have presented solid plans to reopen their outdoor facilities and activities safely. They can open beginning tomorrow morning, or if they need more time, as soon as they're ready. So I would check with each of those individual sports and those facilities before you go make plans. I have worked closely with Sport Nova Scotia. I've reviewed and approved the activity-specific plans for each of these 6 organizations. And I've reviewed them to make sure that they're adhering to the necessary public health requirements, that participants have to keep physical distance, that they are allowed to have washrooms and change rooms open, but maintaining physical distance and appropriate numbers within these facilities need to be followed. They have enhanced protocols for cleaning and disinfecting, and they clearly have protocols to make sure that people are advised that if they're feeling unwell, they are not to come and participate. This is for outdoor activity opportunities if people choose to do any of these 6 sports. We are still not allowing organized coaching or training, competitions, tournaments, regattas, and so on. As I said earlier, there are many other options for outdoor physical activity around the province. And one of those is just recreational boating. And I want to clarify, there's been some thinking that we've actually closed recreational boating down. We never have. So it's important that Nova Scotians know that it's okay to go to wherever your boat may be, whether it's a sailboat, a yacht, a motorboat, that you can go out for sailing as long as you follow the public health requirements. At the facility where your boat may be docked or moored, you got to maintain social distancing. That who gets to go on the boat, those are people within your household or your immediate household bubble. So recreational boating is an opportunity as well. I also have some news about the fire ban, which I know that there's been a lot of interest in about where the status of that. We still have a ban on province-wide open fires until June 1st. However, Nova Scotians can now have a fire in their backyards if they are using an appropriate appliance like a fire pit. You can only sit around your fire, however, with your household or the household in your immediate family bubble. This is another way to get out and enjoy the outdoors. And speaking of my friends, the blackflies, sitting around the fire is a good way to keep them away. So in closing, our actions now, our collective actions, even this weekend, will determine how quickly we can reopen other things in the weeks and months to come. I do hope that this news will be seen as a positive that will help ease some of the pressures and stress that people have been under. I know that there are some people who want to go further, but we have to be slow and cautious here. It's important that people understand that this is not a free-for-all. We have to open things up in a gradual, careful, limited way. We're continuing to monitor the situation closely, and we're looking at the epidemiology. And I have to let people know that if we start to see more virus activity, we may well have to pull back and restrict these activities again. At the end of the day, this is all about individuals' choices. And if people, if for whatever reason they want to continue to isolate or be very restrictive on their exposure, that is absolutely a reasonable and a personal choice, and people should feel comfortable making that choice. All of you Nova Scotians have been with us collectively so far. We're asking you all to just to stay together for a little while longer and follow the rules. COVID-19 is still here. We have good signs, but it's still a risk. However, there is definitely light at the tunnel. So I just want to end by wishing everybody a fun, long weekend, but please do that safely.